This is Heart Rhythm TV, and I am Julie Shea here with Dr. Sunil Vasireddi, who is a clinical electrophysiology fellow at Stanford University. Dr. Vasireddi won the Eric Prystowksy Fellow Clinical Research Award, as well as the Cardiac EP Society Young Investigator Award for the same abstract at this meeting. So congratulations, Dr. Vasireddi.
Thank you.
It's
Thank you
outstanding
so much,
work. So please tell us a little bit about your abstract that you submitted.
In a very large population, over 1.6 million young adult patients of age 20 to 50 years in the Stanford system, we found that sleep apnea was not uncommon and that it portended a very high risk for AFib. Additionally, sleep apnea portended a high risk for stroke with or without AFib, but notably, it's the patients without AFib, which is the majority of the population, this risk for stroke was almost 7 times.
Wow.
Which, again, though the numbers are small because this is a primarily young, healthy patient population, there is a signal here that, that sleep apnea could be kind of helping us identify those at high risk for stroke. Which this could probably be explained by the fact that maybe there's a lot of undiagnosed AFib in this population. Also, there was a low prevalence of anticoagulation, as you would expect, because this is a young, healthy population. And also, there could be other comorbidities that sleep apnea is kind of pointing us towards that would put you at a high risk for stroke that are not related to AFib. And with wearables and everything kind of becoming more and more prevalent, this may be something we need to be evaluating to identify those at the highest risk in the young population so that we can mitigate this risk.
Yeah, absolutely. Do you have any thoughts about next steps in terms of using this data to kind of move forward with other types of analyses?
Yeah. I think the first step would be to kind of extend this analysis to other large centers, have the demographics being more diverse to see, does these risks match up with other large populations? That would be the very first step, because it would be very hard to do a fully randomized trial because of the sheer low numbers involved here. So I think that, and then, going from there, we could then assess, how did data from wearables that are emerging, not just in rhythm monitoring, but also for sleep apnea monitoring.
Right, absolutely. Yeah, because a lot of them will monitor sleep evaluations and things. So, that's a patient population that you wouldn't really think about at all, right?
Absolutely.
And the downstream consequences of that
are pretty dire.
Exactly. So great research. How's the meeting been for you so far?
It's been amazing. Truly an amazing meeting with a lot of very innovative and exciting work that is being discussed. It's truly, I can't express how thrilled I am to be an EP fellow in these times with so much to absorb, so much to learn. I do also want to make sure, I thank Dr. Deb, who is a postdoc research fellow with Dr. Sanjeev Narayan, who's my mentor.
Great.
Both of them have been instrumental toward this work, and their support toward me has been truly amazing. Thank you.
You're welcome. Well, thank you so much for joining me here this morning. This is Heart Rhythm TV, and I am Julie Shea. Thank you for watching.